If you are over 65 and still trying to keep your blood pressure at 120/80 like when you were in your 20s or 30s, I want to warn you, you might be putting yourself at risk of fractures, blurred vision, or even kidney failure, just because of a number that seems standard. Today, I'm Dr. Late Life, with more than 20 years of experience in elderly health care. Let me share with you the truth about blood pressure that not everyone talks about, a truth that could change the way you care for your health from now on. Blood pressure. It's more than just two numbers. Think of blood pressure like the force of water flowing through a hose. Every time your heart beats, it pushes blood into your arteries. When your heart rests between beats, there's still some pressure in those hoses. Systolic pressure is the pressure when your heart beats and pushes blood out. Imagine the strongest surge of water when you turn the faucet on full blast. Diastolic pressure is the pressure when your heart relaxes between beats. Think of the gentler pressure of the water when the faucet is still on but not at full force. Now here's a crucial point. Your blood pressure isn't like a constant setting on a machine. It's always changing. It goes up when you're stressed or exercising and down when you're resting or asleep. What's really important to understand as we get older is that our bodies change naturally. Our blood vessels can become a little stiffer, like older hoses that aren't as flexible. Our kidneys, which help regulate blood pressure, might not work as efficiently as they used to. Even the hormones that help keep our blood pressure in check can decrease. Because of these natural changes, our bodies sometimes need a slightly higher blood pressure to make sure blood keeps flowing well to all our organs. It's like the body naturally adjusting the water pressure in the aging hoses to keep everything supplied.
High blood pressure, the silent storm that can hurt you. We often call high blood pressure the silent killer, or, as I like to say, a silent storm. Why? Because it usually doesn't cause any obvious symptoms like pain or fever. You might feel completely normal, but underneath, high blood pressure can be slowly damaging your body. Imagine that strong surge of water constantly pushing too hard against the walls of the aging hoses. Over time, this can cause problems. Your heart works too hard. Your heart has to pump harder to push blood against the higher pressure. This extra work can eventually lead to the heart becoming weak and failing. Trouble for your brain. High pressure can damage the blood vessels in your brain, increasing the risk of a stroke and even contribute to memory problems over time. Kidney problems. Your kidneys filter waste from your blood. High blood pressure can damage the tiny blood vessels in your kidneys, making them less efficient at their job and eventually leading to kidney failure. Vision problems. The small blood vessels in your eyes can also be damaged by high blood pressure, potentially leading to blurred vision or even vision loss. Feeling unwell. Emotionally, you might experience things like feeling constantly tired, easily irritated, and having trouble sleeping, even if you don't realize it's connected to your blood pressure. The danger is that many people only realize they have high blood pressure when serious damage has already occurred because they felt fine. This lack of obvious warning signs is what makes it so important to get regular checkups.
Why that perfect 120/80 might not be right for you after 65. For years, we've heard that 120/80 is the ideal blood pressure, and that's generally true for younger, healthy adults. However, as we age, our bodies function differently. Think back to those aging hoses. They're less flexible than new ones. Our kidneys aren't working at the same speed, and our bodies process medications more slowly. So, trying to force the blood pressure down to 120/80 using strong medications in someone over 65 can sometimes cause more harm than good. Imagine trying to reduce the water pressure in those less flexible hoses too much. It might lead to dizziness and lightheadedness. Your brain might not get enough blood flow if the pressure drops too low. Fatigue and weakness. You might feel unusually tired and weak. Fainting. In severe cases, the drop in blood pressure can cause you to lose consciousness. Falls and fractures. dizziness, and weakness significantly increase the risk of falls, which can lead to serious injuries like fractures. Worsening kidney function, ironically, pushing the blood pressure too low in some older adults can actually further strain the kidneys. I remember a 70-year-old patient of mine. His natural blood pressure was around 145/85, and he was active and enjoyed life. When he saw a new doctor who insisted on getting his pressure down to 120/80 with medication, he started experiencing severe dizziness and fell twice. He came back to me confused and asked if he was on the wrong medication. I explained that the medication itself wasn't necessarily wrong, but the target blood pressure was likely too low for his body. What the latest research tells us. Two important research studies have helped us understand this better. The SPRINT study showed that for some people, lowering blood pressure below 120 could reduce the risk of heart attacks and strokes. However, it also found that older adults in this intensive treatment group experienced more falls, kidney problems, and other side effects. This highlighted that pushing too hard to reach that low number wasn't always safe for seniors. The CHART study further supported the idea that for many older adults, especially those with other health issues, aiming for a moderate blood pressure control, not too high and not too low, is often the safest approach. Based on this kind of research, many experts now suggest that for older adults, a more realistic and safer blood pressure range might be between 130 to 150 for the top number and under 90 for the bottom number. This range allows for good blood flow without increasing the risk of those dangerous side effects. It's all about what's right for you. It's so important to remember that every older adult is unique. There's no one-size-fits-all blood pressure target. For example, someone with diabetes might need a slightly different target than someone who has heart disease or has had a stroke. A very healthy and active senior might be okay with slightly higher numbers than someone who is frail. That's why I always tell my patients, don't chase the perfect number on the machine, chase the feeling of being well. How are you feeling? Are you dizzy? Are you energetic? These are important factors your doctor should consider. Lifestyle changes, more powerful than you might think. Medication is often necessary to manage blood pressure, but it's just one piece of the puzzle. The way you live your life has a huge impact. Here are some key lifestyle changes that can make a real difference. Reduce salt and processed foods. These can significantly raise your blood pressure. Try to cook more meals at home using fresh ingredients and be mindful of hidden salt in packaged foods. Eat more fruits and vegetables. Focus on a colorful diet rich in vegetables, especially leafy greens, and fruits like bananas and sweet potatoes. Include healthy fats. Don't be afraid of good fats found in nuts, olive oil, and avocados. They're good for your heart. Get moving, regular physical activity, even gentle exercise like walking, light yoga, or Tai Chi can help lower blood pressure. Aim for at least 30 minutes of moderate activity most days of the week. You don't need to train for a marathon. Prioritize sleep and manage stress. Getting enough quality sleep and finding healthy ways to manage stress, like relaxation techniques or meditation, can have a positive impact on your blood pressure. Maintain a healthy weight. If you're overweight, losing even a small amount of weight can help lower your blood pressure. Stay socially active and positive. Feeling connected and having a positive outlook can contribute to overall well-being, which can indirectly help manage blood pressure. These lifestyle changes can often reduce the need for high doses of medication and help you feel better overall. Using blood pressure medication safely. If your doctor prescribes blood pressure medication, it's crucial to use it safely and understand what you're taking. Don't just aim for the lowest possible number. You need a balance between controlling your blood pressure and avoiding harmful side effects. Here are some important questions to ask your doctor. What is my ideal blood pressure target? Considering my age and health, it shouldn't just be a generic 120/80. Can I manage my blood pressure, at least in part, through diet and exercise? See if lifestyle changes can reduce your medication needs. Does this medication increase my risk of falling? This is especially important for older adults. Will this medication have any negative effects on my kidneys, eyes, or memory? Understand the potential side effects. A good doctor will listen carefully to your concerns and tailor your treatment plan to your individual needs, not just focus on a number on a blood pressure cuff. Conclusion: your real goal is a good life, not just a number. I always remind my patients, we don't live just to reach 120/80. We live to feel well, sleep peacefully, and not be afraid of falling. Blood pressure is just one piece of the puzzle. Your overall health, your happiness, and your independence are what truly matter. So please, get your blood pressure checked regularly. Don't skip those appointments. Talk openly and honestly with your doctor about your concerns and how you're feeling. Make small but meaningful lifestyle changes that you can stick with. And most importantly, listen to your own body. It will often tell you if something isn't right. I'm Dr. Late Life, and I'm here to help you navigate the complexities of aging with a healthy heart and a vibrant life. If you found this information helpful, please share it with your family and friends, especially those who are managing high blood pressure. Leave a comment below if you have any questions. I'll do my best to respond personally. And don't forget to subscribe for more videos focused on helping you live not just longer but better. Thank you for watching.